How's your pain doing at the moment?
It's in my back. It's
in your back? Yeah.
And obviously I'm frozen.
Trying his best to comfort Mavis is her husband, Kenneth.
We're going to measure that temperature again and try and get you a bit warmer.
She went to study well this morning and I got a phone call saying come down because she's not well.
This is Mavis. She was crossing the road and a car struck her to, we think, her right-hand side. She's landed 3 metres from the car, face first. We're on the floor about 40 minutes before we got there. She's got a large laceration just above her left eyebrow, the graze to the top, and then I don't know if she's got a fractured dislocated foot. Quite a lot of blood, to be fair, clotting everywhere.
We don't know how fast the car was going.
The police said about 20 to 25 miles per hour.
She's being thrown up.
So she was on this side of the pavement and she's landed against the other. So she's gone the full width of the road. Husband had been shopping with her. He went to put the shopping away and then thought, oh, she's been a while. And then went and found the road.
Okay. My concern for Mavis immediately is she could be bleeding internally, could be multiple broken bones, problems if she's got lung injuries, okay, all these things are potentially, life-threatening in someone like her.
Assisting Dr. Young is Dr. Kate Hargreaves.
We've got no obvious external hemorrhage. She's alert, orientated. Chest sounds fine. A small amount of left-sided chest wall tenderness.
Yep.
Belly's nice and soft. Moving all 4 limbs. Obviously got some laceration to her head.
Yep.
But nothing else like that.
Can we monitor
immediately. We're just getting monitoring on it now, yeah.
Okay, good.
With potential life-threatening injuries, Mavis needs to be assessed straight away.
And if you just bring your teeth together for me, do they feel normal together? They do. But the eyes were equally reactive when I checked initially.
Just press on the upper lip.
It's an anxious time for husband Kenneth. While the team in Resus is trying to uncover the extent of Mavis's internal injuries, Resus, 76-year-old Mavis is in severe pain after being hit by a car.
Are you warmer now, Mavis?
Not really.
I can't find her for all these blankets.
You're still feeling cold?
Still a bit, yeah.
Have a finger there.
I'm not moving it.
With the risk of internal bleeding, the team needs to find out the extent of her injuries quickly.
What we're going to do now is we're going to take you around to have a CT scan if you need some pain relief before we go. Yeah? We have some IV paracetamol as well, we're going around and then. Someone, as we're getting older, into our 70s and 80s, even just a fall from standing can cause serious injuries from chest injuries, head injuries. So someone who's been hit by a car at reasonable speed, you've got to assume there's going to be quite a lot of damage happening.
Are we ready to rock and roll?
Yeah, indeed, yeah. All right, we'll see you in a minute.
All husband Kenneth can now do is wait. Over in radiology, Mavis has had her CT scan and is taken back to Resus. Dr. Hargreaves monitors her condition.
How's your pain doing at the moment?
It's in my back. It's
In your back?
Yeah. And obviously I'm frozen.
Come on, can we measure him again? If it's low, we can get the bear hugger on.
Trying his best to comfort Mavis is her husband, Kenneth.
We're going to measure that temperature again and try and get you a bit warmer. Just going to loosen one of these. Keep your head nice and still for me. Yeah, we'll get a nice warming blanket on you, I think.
Right, thank you.
You're welcome.
As a result of shock and trauma, Mavis's body temperature has plunged.
You're going to wish you'd got one of these at home. Trust me.
To prevent potential organ failure, nurses Lisa and Mimi warm her up with an inflatable blanket filled with hot air.
Lovely. Off we go. You're cooking. What temperature? High, medium? High. Right.
You're warmer now?
Yeah. A lot warmer.
You don't want to come home now?
It feels lovely.
We have young men who come in with
less than half the injuries that this young lady's got, and all they do is squawk. This lady just doesn't. She's tougher than a pair of road bulls, aren't you, maybe? Typical Barnsley lass. As hard as nails.
On that scan you've just had, your neck's absolutely fine. All of your body's absolutely fine. There's no bleed in your brain or anything like that. They think you might have broken just the bone along the side of your face there, but I hope that that will just heal on its own. I'm going to have a chat with the specialists, but there's nothing that is untoward at all on that scan, okay? So what we're going to do is slowly, we're going to get you out of all of these blocks and things and let you sit up a little bit and see how you feel.
Whilst not life-threatening, Mavis does have multiple injuries to her head, face and hand.
Okay,
That's fine.
should we stop there for now?
Yeah.
Right, we'll want a couple of stitches, okay? It's all the way across your eyebrow. So we want to get a nice finish for you. And you need an X-ray of that thumb as well, don't you?
Yeah.
Yeah.
Have you got a tissue? From this left-hand side.
Left-hand side.
That's it.
There's some dried blood on your lip, you
I
see.
know.
Have you got any allergies, have you, maybe?
Only my husband
Only you, oh, he seems like a good one.
is.
Well, how long have you been married?
How long have you been married then?
57 years.
57 years, that's it.
Oh, goodness me, congratulations.
20 on them's been happy.
You were a dinner lady at school?
Yeah,
You were a dinner lady.
I used to be a dinner lady in a past life.
Did you?
I did, I'm a lollipop lady.
I'm really sorry, darling. I know it's going to be a little bit tender here.
yeah, it is actually.
Sorry, sweetheart.
I'm not coming home till it's lovely and warm and
She's stopping in this bed, Ken.
Yeah.
You've
I
got
want-
bed
I
to
want
yourself
this
tonight, love.
A full bed instead of a third.
With treatment still needed, Mavis heads for an X-ray on her damaged thumb.
see you in a bit.
Okay. Behave.
76-year-old Mavis has had an X-ray on her badly damaged thumb and is heading back to Resus. Dr. Maz Yousafpour, a specialist in facial injuries, arrives to assess the deep lacerations on her face.
My name's Maz. I'm part of the Oral Max facial surgery team, so it's nice to meet you. So I'm going to have a little look at your face, okay?
You're getting there, aren't you?
I don't know how painful this will be.
Well, I'll try and be brave.
I'm going to remove that little dressing that's on the side of your
just a
face.
little bit.
Is that okay? Are you comfortable?
As comfortable as I will be.
Let's have a little look. Yeah, so
That's sore. in
that's
there now.
sore here. Okay. Up here as well.
No.
And so here, which is understandable. You've got quite a bit of swelling in that area.
Dr. Yousafpour starts to stitch Mavis's wound.
Short scratch. Okay, is that all right? Short scratch again. There we go, well done. Any pain at all?
No.
This?
No.
There's no injury to the eye, so that's obviously the most important thing, isn't it? There will be a scar at the end.
I think she's doing very well. She seems to be just telling them they can get on with it. She's much tougher than I am. Can't be easy. 'Cause it's different parts of the body, isn't it? It's not just one specific thing. Very proud of her.
Mavis, we're all done. So what we'll do is we'll see you again in 1 week's time, and we'll remove the stitches because we only want them to stay in for 7 days, and then we'll review you regarding your facial fractures as well, just making sure that everything's okay.
Right, thank you very much.
Is that all right? No problem at all. Take care.
But Mavis's urgent medical care is not yet over. Her hand is so badly injured, she needs specialist care to avoid long-lasting damage to her thumb. Still in Resus is 76-year-old Mavis. At risk of losing her thumb, she's waiting for the results of her X-ray.
Are you ready? I think the thumb man cometh. He'll numb it for you.
I don't know.
I'm telling you. He's going to numb it for you.
Orthopaedic surgeon Mr. Khan is the 6th specialist to treat Mavis today.
Hello, Mavis. Oh, bless you. I heard that you were injured. You got knocked down by a car. Now, what I could see on your X-rays is your joint is sitting out of socket, and there's a bit of tear on the skin. I'll give a bit of local anesthetic to make it numb, okay? And then we will just try to push it back in place. We'll look after you, okay? So just to bring your hand up, you don't have to look at it. You can just look away.
I will.
Okay. Well done.
Mr. Khan must realign the thumb as quickly as possible.
Skin in Mavis age group is quite fragile. So you just have to make sure inside pressure it doesn't lose its vitality and dies out. And if it dies out, there would be more complex treatment, and some people do end up losing their thumb. So Miss Mavis, it's gone a bit numb.
It has got a bit numb, yeah.
Brilliant, brilliant. Okay, just relax now. Okay, now are you strong enough?
I don't know.
How does it feel?
Okay. Just stinging a little bit.
Yeah, yeah. Just relax now. That's gone back now.
Oh, is it good?
Yeah, look, it's gone straight. Okay?
Good. Good. Magic
See,
fingers.
I can move the thumb now. It was like a
Oh, yeah, you can.
burner before.
Oh, yeah, that's brilliant.
But the job is not completely done yet. You just have to take it to theatre, wash it properly, and suture it. Okay? But for the time being, the pressure that was on your skin is taken off. Skin would have gone black. Save the skin around it and save the joint for the time being by pushing it back in place. So, acute emergency is over. Thank you.
Do you want some tuba grip on that?
A wool and crepe bandage.
Yep.
Not coming home.
After having her thumb stitched, Mavis was admitted to the orthopaedic ward and was released home to husband Kenneth 5 days later. In the packed waiting room, 77-year-old Avril has arrived with her partner Robert. They were in the supermarket when a heavy boxed barbecue fell onto the back of her leg, causing a nasty cut.
Yeah. I'm coming out, and there's somebody behind me got a big barbecue on the trolley, and it slid off into the back of the leg. And it was getting like a skinner. Good. Robin, my head.
Nurse Steph examines her injury in cubicle 2.
Can I take this bandage off and have a look? Yeah. Who put this on for you?
I'm on get some
I'm sorry. I just want to have a quick look at it.
That's the skin. You slid it down. Thank you.
Avril's wound is in danger of becoming infected. She needs to see a doctor urgently.
I'm just going to keep that in place. I'm just going to go and get James, one of our doctors, and he's going to come and have a look at it.
And what have you done?
Somebody's been following me with a trolley, and the barbecue's falling off it. Slid off it.
Oh, okay. So it was like balanced on the top, was it?
Yeah.
And it's, oh gosh. And, yeah, and it's caught the back of your leg.
Yeah, and there's bees like that hanging off.
Oh dear. All right. Let's have a look then. It's quite a good one, isn't it?
It is that.
Sorry, my love, sorry. Avril's got a nasty, what we call sort of skin tear to her lower leg. It's quite common in older patients who've got very thin, fragile skin that they suffer these nasty wounds that you can't then stitch because the skin is too thin. If they've got areas of skin loss, then we just try and bring it as close together
and then dress it and then continually review it for wound healing, because sometimes these patients go on to need like skin grafts and specialist procedures under the plastic surgeons. We might be better getting our nurse practitioners to have a look at this, because I'm not sure how much of that skin will lift up. But we'll give it a soak and get it as close as we can, and then we might just need to dress it and bring you back to our clinic to have a look at it in a few days.
Avril's wound will need to be closely monitored, as her age makes her vulnerable to further complications.
As we get older, our immune system's not quite as good. Also, if we have difficulties with our circulation, then that can cause problems with wound healing, particularly in the lower extremities. So yeah, she's at risk and we need to keep a close eye on it.
Avril's leg wound has been treated by one of the emergency nurse practitioners.
Put flat back, and they've got to go and curl it at top, and make it thick. And then they might put stitch plasters all the way around it.
They've got it at the back in its position, yeah. So it'll leave a scar, but it'll leave an out, he says.
I'm too old to worry about that.
A scar.
About scars, I've already got plenty.
Bandaged up, Avril is allowed home. Her leg is still healing and she's visited weekly by a district nurse. Married couple Bev and Brian arrive after falling ill at the holiday cottage they rented.
There's 2 chairs in there if you want to take a seat.
Nurse Jasmine is triaging them.
Hello, how are you feeling?
A bit groggy.
Have you got any chest pains or anything?
No, I was just a little bit short of breath.
Feel short of breath as well? Or?
Just felt really dizzy. Just like I've got a hangover, a really bad hangover.
And you definitely weren't drinking then?
I had 1 glass of wine last night.
Yeah, not enough for a hangover, is it? What is it that happened?
We're staying in a holiday cottage, and that's got a log burner.
Okay.
And there was a lot of fumes coming from it.
Yeah.
The carbon monoxide detector went off a couple of times. And then when we got up this morning, the fumes were still significant downstairs.
Yeah.
So we phoned up 111 and they advised us to come here within the hour.
Okay, yeah.
Yeah, we're only 10 minutes away from him, aren't we?
Yeah, well, fingers crossed.
And we've got
Test
George,
her
our
out.
Cocker Spaniel with us as well, so we've had
So
to
my
leave.
brother's took my dog, yeah.
Oh, you should have brought her with you. Yeah.
So I didn't really sleep much last night.
No, of course.
So I kept checking to make sure he was alright.
Yeah, I think you get more worried about your dog, don't you, than your other half sometimes.
Yeah.
Yeah, so we'll do a blood test on you both.
Yeah.
It tells us the results straight away anyway. And then we'll wait for a doctor to come and see you. All right.
That's great, thank you.
I'll be back in a few minutes, okay?
Lovely, thank you. Hopefully it'll be alright.
My name's Adam. Goes alright.
Carbon monoxide poisoning causes around 60 deaths every year in England and Wales. Symptoms can include chest pains, seizures and brain damage.
We'll get that test out, come back out, I'll do yours.
Yeah, lovely, thank you.
The blood test will measure whether any lethal gas has been inhaled. If they have carbon monoxide poisoning, there could be long-term effects.
The results came back. As long as your carbon monoxide levels are low, if it was above 5, then we would have to think about admitting you into hospital. Well, thankfully that's not the case. Yours, Brian, was 3.3, and Beverly, yours was 2.9. So.
Yeah, that's great.
Is that right? Yeah. Do you have any other questions? Anything that's worrying you?
No, I think you've covered it really well. Yeah.
From our side, we're happy for you guys to go home. Thank you.
Thank you.
The tests confirm the carbon monoxide levels in their blood are low enough to not need treatment.
Relieved.
Relieved,
Yeah.
yes. It's quite scary.
Did get a bit worried, didn't we?
Yeah.
It is a silent killer at the end of the day, and you have to take it seriously
So-
to be wary of it in the future.
Brian's been in agony for a week, ever since he fell backwards in his garden while pulling up roses.
I got to the last one and I was tussling a bit, and then all of a sudden he changed his mind and whoosh, and I went back, straight back.
Poor old you. Shall we just have a little look at the beast? There we are. Well, that's very impressive, isn't it? The first thing we need to do is x-ray it. There's quite a lot of blood here that's leaked into the skin. It's really warm, so there's a lot of inflammation going on as this is trying to heal itself. It'll take weeks.
Did you hear that, Brian?
Yeah.
So this is not going to go away quickly. There may not be a huge amount that we can do to speed things along. I'm concerned that because he's in so much pain, there may have been a fracture that he sustained when he originally fell that needed to be identified. If he goes unchecked, he will just deteriorate further, and that would lead to him ultimately needing to be admitted to hospital, which is not a good thing for him. What happens to this really, really hard stuff is it becomes, as the body tries to reabsorb it, it becomes very liquid. And occasionally what we can do is pop a needle in and draw that out.
Right.
At the moment, if I popped a needle in there, nothing would happen. We just need to make sure there's not an underlying bony injury that could have happened at the same time, particularly around the pelvis, so I'd just like to check that if that's okay.
If his condition deteriorates, Brian could be facing surgery and a prolonged stay in hospital.
Right, let's take a drop of blood off you. Have you got a good arm? Marvellous. He has lost quite a lot of blood into that bruise, so that shows me that there's quite a lot of blood held in that area of the body, and I want to check that his blood count hasn't dropped. How long have you known each other?
81 years.
Oh my goodness. And when did you finally decide you were madly in love with each other?
Oh, 32 years ago, after we'd had a trial with someone else.
Ah!
We were both married before.
And then you got back together just by chance, or?
Brian was in a choir in the village where he lived, and they asked him to sing solo. So he rang me and said, could he come over and rehearse with me? And eventually we got together. Yeah.
Well, I've just about got used to it now.
I've got used to it now.
I can't believe you said that.
Yes.
Dr. Mason has arranged an X-ray. If there are fractures, Brian could be facing an operation and months of rehab.
This is the affected area, so he's having pain in the hip and the pelvis. So your X-ray's fine, nothing broken,
Wow.
which is good.
Thank you.
The blood tests do show that your blood count has dropped quite significantly, probably as a result of where it's all gone into there. So you're now quite anemic, and I think that's probably why you're not feeling too great. So what I'm suggesting is that we put you on some iron tablets to lift that blood count back up again. You will start to notice a difference in a couple of weeks' time. Your blood count will be going up and you'll start to feel a bit better.
After a course of iron tablets and a few weeks' rest, Brian felt strong enough to tackle his hydrangeas.
Bye-bye.
Under the strict supervision of Iris, of course. Paramedics are bringing in a 65-year-old female who they suspect is having a stroke. Nurse Becky takes the handover.
What we do now is, this morning at 8:30, she got and had sudden onset of central chest pain, saying she couldn't breathe, she couldn't even speak in full sentences, it was literally one-word answers. Notice the right side of her face was it drooped, but that's normal for her belt palsy. She's unable to recall that she'd been to Slimming World at all, which is a shame because she's had a good week.
Teresa and husband David are taken to cubicle 9, where physician associate Wayne has noticed her sudden deterioration.
Anything in your chest at all? So what happened today?
Well, she went to Slimming World this morning, and I got a phone call saying come down because she's not well.
More or less sorted.
Because of Teresa's chest pain, Wayne does an urgent ECG to check her heart.
Have we taken any blood yet?
I don't think so.
I think the nurse, I only popped in because I saw you were obviously becoming a little bit unwell.
So I shall see where they've got to in terms of assessing it.
With Teresa's condition becoming worse by the minute, the team needs to work out what is causing her to feel so unwell. In charge of her care is consultant Dr. Laura Buxton.
So, it says in my notes that you've been confused, more confused than normal. Does that fit with how you feel?
When I get very tired.
Can you remember back to when you got up this morning and how you felt?
I was breathless all morning. It weren't normal, do you know what I mean? Really breathless all morning.
Can you see my face normally?
Yeah, but it's a bit blurred, but yes.
Is it?
Dr. Buxton quickly assesses Teresa for any signs that she could be having a stroke.
What I'm going to do is get you to stretch both hands out in front of you and keep them up. Shut your eyes. Good, and I'm going to push on them and you're going to keep them up, okay? Good. Can you lift this leg up? Up strong. Good, and this one. Good. You've got weakness in your right arm and in your right leg. And I just think that there's a possibility it might be a stroke. So I'm going to get a brain scan, see where that takes us, and I'll get one of the stroke nurses to come and have a look at you. Okay. It's just a little bit of an unusual presentation for somebody who might have had a stroke. She does present with a mixed picture of confusion. She's got quite a complicated past medical history. So it's not a typical case of a straightforward stroke.
If Teresa is having a stroke, she'll need treatment straight away to limit any damage to her brain.
I've looked at your CT scan, I can't see anything untoward. So I just need to get a clear picture basically of what's been going on and how long this has been going on, right?
I remember being at Slimming World, but that's it.
When you're saying you can't remember,
Just can't remember.
Yeah. She's got memory problems to start with.
I had a cardiac arrest.
In 2012.
and since then, has she been...
Yeah, she was starved of oxygen.
Right,
So she's had memory problems. And the tighter she gets, the more confused she gets.
So you've been having these memory problems has been long-standing since 2012?
Mainly when I get tired, but...
and mainly when you get tired.
I don't normally forget so much. It's normally quite good, what I remember, but I can't remember this morning much.
Yeah.
But, what was I saying? Just now.
You can't remember it all the time.
I can't remember now.
You're not as bad as that.
No, I'm not this bad.
Nurse Pauline updates Dr. Buxton.
There's lots of different things I think that's going off, and she probably will need an MRI.
That's my concern, that she's having fluctuant episodes where she has complete lucidity in between. And for her to have a process that was causing memory loss, confusion, that was transient, that got better with a rest at night, seems unusual.
I think it's very unlikely that it's stroke related.
Okay, well, that's been really useful, thank you. I'm grateful for your second opinion. Okay. Did everything that we've been chatting about make any sense to you at all? No, perhaps not. So, we've got some concerns about your memory and about your confusion. And what we want to do is admit you for a bit of time so that we can work to get to the bottom of what all these symptoms are being caused by. Okay?
Don't keep me for so long.
I won't keep you for long, I promise. We'll do our very best. We don't think this has been a big stroke. It's something maybe going on in the brain that's causing you to have these acute episodes of confusion.
I could sleep on a washing line. But yeah, I just need some sleep. I'd sooner be going home and going to bed so I could sleep properly.
It could be a couple of days actually.
But I know there's something going wrong and it needs sorting out. It's just one of them things. But there'll be a lot of people in here a lot worse off than me, so...
Teresa stayed overnight, when it was discovered her symptoms were caused by her pre-existing heart issues. She's now home and her treatment is ongoing.